What are some of the common risks of having a breast reduction? Well, thankfully, there are very few, but there are some serious risks that you should be aware of. And so I wanted to spend some time going over with you some of the risks I speak to my patients about and your surgeon should be speaking to you about. So the most common thing that we see in any breast reduction, number one, is changes in nipple sensation. Your surgeon will be moving your nipple up based on various what's called vascular pedicle, which is another term for how we keep the nipple alive. And it's important to know that when we move the nipple up, you can actually have some changes in sensation. The nipple can be more sensitive, less sensitive, or lose sensation altogether. Thankfully, somewhere around 80 to 90% of the time, this sensation will return, but there is about a 10 to 20% chance that the nipple sensation could be permanently altered. Breast reductions also come with a fair number of incisions, and you can see one of my other videos about exactly what kind of incisions you can expect. It is possible to have some sort of wound healing issue, meaning you may have some version of an open wound, whether it's small or large, after your breast reduction. Thankfully, large open wounds are very uncommon, and needing secondary surgery is very uncommon. It may be more common, though, for you to use some antibiotic ointment or dressing changes to heal any type of resulting wound from a breast reduction. One very little known complication of a breast reduction is that when we move your nipple up, it can actually die. That's not just a rumor you hear on the internet, it is actually true. So how often does that happen? The answer is extraordinarily rarely when breast reductions are performed in the appropriate candidate. And you think sometimes somewhere near very close to 0%. Now, it's not 0%, obviously it does happen occasionally, think once every 5 to 10 years. However, it can happen and it is a very real risk. Now, other things that you typically get scared of during any surgery, like bleeding, infection, or damage to other unintended structures, these are extraordinarily rare in breast reduction surgery. Of those three, the one that most people think about is bleeding, and this is the reason most people think about utilizing drains in breast reductions. It's important to note, though, that drains do not prevent a hematoma or a collection of blood under the skin. They can help identify hematoma, but they will not necessarily protect against it. They can protect against a different complication called a seroma, but seromas are very rare in breast reductions. This denotes a small collection of fluid under the skin that's more like normal body fluid. Again, these are not very common in breast reductions, and that's why many surgeons, including myself, have moved away from putting drains in breast reductions. These are all complications that we talk to our patients about and your surgeon should be talking to you about. These are things that you should definitely ask your surgeon because remember, it is your body and your results that matter.